Grant Dean, and this is Advocate Today. In Illinois, a bill to restrict license plate readers from being used against abortion care seekers is awaiting the government's review. State lawmakers passed the bill to prevent authorities in other states from accessing license plate reader data in Illinois with the intention of punishing people seeking abortions. If signed by the governor, it would be the first measure of its kind in the U.S.
This law prohibits the sharing of data, as others have said, or permitting any law enforcement agency to use this data to weaponize information against anyone in the state of Illinois seeking reproductive health care.
Illinois is among 16 states that put abortion protections in place following the U.S. Supreme Court overturning a Roe v. Wade a year ago. New York's Attorney General is filing a federal lawsuit against the anti-abortion group called Red Nose Rescue. The lawsuit alleges that the group and its members illegally blocked access to healthcare clinics. The lawsuit aims to prevent Red Nose members from coming within 30 feet of any reproductive healthcare facility. Red Nose Rescue is active in other states, including New Mexico and Michigan. A new study shows that more kids, teens, and young adults are experiencing anxiety, but fewer are getting the right treatment. The data comes from the National Ambulatory Medical Care Survey from 2006 to 2018. Researchers looked at office-based physician visits to see how many included an anxiety disorder diagnosis and what treatment, if any, was given. They found that while visits for anxiety increased, the proportion of visits with therapy decreased. They say that's troubling, as existing evidence shows that for most people, therapy is the best way to treat anxiety. And for severe cases, a combination of both therapy and medication is recommended. The study is published in the journal Pediatrics. A key player in the fight against COVID is leaving the Biden administration. White House COVID-19 coordinator Ashish Jha is leaving his post. Jha led the response team, which coordinated the national rollout and distribution of vaccines, treatments, and medical supplies. Biden praised Jha, whose actions, he said, helped save and improve the lives of millions of Americans. The administration is expected to disband its COVID response team after the public emergency ended on May 11th. A Boston University study found that racial and ethnic disparities in COVID-19 mortality decreased nationally for some groups during the first 2 years of the pandemic. But this decrease was mostly explained by increases in mortality for non-Hispanic white adults and changes in pandemic geography. I spoke with the Boston University research fellow who authored this survey about the data and building health equality. So recently you helped author a study that talks about COVID-19 mortality rates when it comes to race and ethnicity. And it was kind of surprising, some of the things that you all found. So can you kind of give us some of the highlights of what it is that we can find in this study?
Definitely. So prior to the study, it was known that, the racial disparities with the mortality rates between, Black Americans, Hispanic Americans, and white Americans decreased in the second year of the pandemic. However, the mechanisms behind that weren't necessarily uncovered. And we found through our statistical analysis that much of the decrease in the disparities was due to increased mortality in white Americans, as well as, this mechanism of the COVID mortality rates increasing within rural areas versus, decreasing in urban areas. And there's a lot to be said about, the rural disadvantages in terms of mortality rates and health structures there that really affect those outcomes.
So when it came to doing this study, what was the inspiration behind it? What made you all want to say, hey, let's take a look at this?
There was prior research that was done by our team looking at this sort of rural urban disparities. There is, as well as differences in mortality between the urban and rural areas, just differences in distribution of where individuals live. And, part of that is impacted by systematic racism, just what drives certain populations to live in certain areas, and how does that impact mortality. And so that was sort of the thinking going into that.
And within these rural areas, were there certain age groups that that had higher numbers than others?
Yeah, so generally the rural areas were older, and COVID tends to hit older populations harder, and we actually had to disclude the age group under 25 because of data suppression. Under a certain number, the CDC doesn't release those numbers.
Putting together this data, were you surprised by anything?
Yeah, I mean, there was this narrative that going on that, disparities decreased in the second year of the pandemic. And it was kind of being pushed as this is great, like we're doing better. But really, uncovering that a lot of the drivers of that change in disparities was an increase in white mortality and an increase in mortality in rural areas. It kind of turns that narrative on its head.
And now that we have this data that you all have put together, what can communities, politicians, health professionals all take from this?
Sure. I mean, it really emphasizes how even if there is a number nationally that disparities are decreasing, there is a lot of difference based on geographic location, and it's really important to dig down into those granular levels to really see what's going on under the hood. And as I was saying, prior evidence has shown that rural areas have worse health outcomes due to different mechanisms and due to lack of funding, lack of infrastructure, health infrastructure, and such. And it's something that we definitely need to be paying more attention to and investing more in our rural communities.
Since doing this study, have you all noticed any kind of numbers changing? Have things kind of stayed the same, or are you looking at new factors and variables now?
Sure, yeah. I mean, one thing with the CDC mortality data is there is a lag in terms of the numbers that are reported, because especially for rural areas, it takes a while for all of the death certificates to be reported to the CDC. And so, this study only went up to February of 2022, and we're currently in the middle of 2023. We haven't necessarily looked at, this particular analysis and how it's changed up to this point. But it's definitely something that we're thinking about, and we are still, digging into the question of urban versus rural outcomes when presented with, national statistics to keep in mind that there might be other things going on within smaller demographic subgroups and regional subgroups and such.
All right, thank you so much for that. We really appreciate it.
Mm-hmm.
The Advocate Channel, Equal Pride, and Out Magazine are joining with iHeartMedia and Procter & Gamble for one of the biggest Pride celebrations online. The Advocate Channel is the official streaming partner for Can't Cancel Pride, and it's going into its 4th year. This year's host is JoJo Siwa, and you can watch Can't Cancel Pride right here on the Advocate Channel at advocatechannel.com and stream it live on the app. Can't Cancel Pride begins streaming June 15th at 8 p.m. Eastern, 5 p.m. Pacific. And thanks for watching Advocate today. Download the app in the Apple or Google Play Store to stream us live, and you can even subscribe on our YouTube channel. Make sure you do it. For the Advocate Channel, I'm Aaron Dean.